is Nurshazatul Shazwana binti Hashim. My matric number is 270362. Today I will presenting about management of the chronic disease on ovarian cancer. Ovarian cancer is actually irregular cell development that starts in the ovary area. In Malaysia, ovarian cancer is the 5th cancer that leads to female death. It is also harming female in the range 40 years or older. Okay. There are 3 types of ovarian cancer. First is epithelial ovarian cancer. Epithelial ovarian cancer is the cancer that develops on ovary outermost layer. It includes endometrioid cancer. The second type is germ cell ovarian cancer. It derives from the germ cell that called oocytes that generates by ovarian cells. Okay. It can be untreatable or malignant. The third type is stromal ovarian cancer. Stromal ovarian cancer derives from the cells that produce hormones such as estrogen. It is likely to harm female who are 50 years old and above. Ovarian cancer do have the risk factors. The first risk factors is the female who inherit defective genes that result to Leach syndrome. Secondly, female who undergone radiation therapy from previous cancer. Female who are having endometriosis and diabetes and also not used to birth control such as a pill and implant will likely to get ovarian cancer. Last and the most important risk factors is smoking. There are also signs and symptoms that female need to look out and give attention to. Firstly, if they have abdominal swelling or bloating. If they are experiencing weight loss, if they have abnormalities in bowel habits, excessive urination, and also if they are facing pelvic discomfort. That's all from me. Thank you.
Assalamualaikum and a very good day. My name is Nurshazatul Shazwana binti Azhar and my matric number is 270189. I will continue my part, which is I will talking about the case from the social media that was chosen by us. From the video chosen, the ovarian cancer is one of the chronic illness. The illness happened to Amanda Kebabe, 25 years old woman. At first, patient was not know that she was that illness, but she had a feeling that something was wrong in her lower right side of stomach and was growing inside her stomach. For the first, when she only heard about cancer and think that if one person got a cancer, they will die. However, with proper care and treatment, people can survive cancer. This is because another definition of chronic disease is required ongoing medical attention or limit activities of daily living or both. Patient also told that back in high school, she always felt pain in her stomach, and when she in college, it's become worse to the point it can't be explained. She also told that in August of 2017, when she was working on the boardwalk, she had to stop walking. After that situation, patient meet the gynecologist and told that she just lost 15 pounds of weight, but her stomach is still sticking out, and the doctor asked her to eat less carb and eat more lean protein. This is because chronic disease can relate to people lifestyles, like unhealthy diet. After doing an ultrasound check a few times, doctor told that patient got a 13 centimeter cyst. The doctor also thought that cyst is common among women and it just rupture, and sometimes women don't even feel it at all, but it can be quite painful. The cyst is called a dermoid cyst, which it began with tumor and they just need to remove it. On November 2nd, 2017, the patient got her surgery. Her cysts were on stage 1A, which is the earliest stage, and on the grade 3, which is the highest grade, which means it will spread really fast. People who get the cyst or cancer will lose their hair for a while, but it will grow back later. On the third week of the illness, the patient's hair started falling out. Amanda's last dose of chemotherapy was on January 13, 2018. She still lived every day with kind of just reminders everywhere that the chemo happened and the cancer left a scar across her stomach. Cancer can cause depression to patients, and they have to cope with it and embrace it in a world way. The disease also influenced Amanda's ability to work because she needs to do her chemotherapy during work.
Greetings and good day. My name is Hezlina binti Jusit, method number 270639. Today, I will present about how to manage or deal with ovarian cancer. Management of ovarian cancer has two ways, which is pharmacological and non-pharmacological treatment. Both of these methods need to be understood not only by the ovarian cancer sufferers themselves, but also their loved ones who will take care of them and stick with them in their journey against this dangerous disease. After completing the surgery, the patient will be given an injection of chemotherapy medicine. This is intended to kill any remaining ovarian cancer cells in the patient's body. The most recent agents used in ovarian cancer chemotherapy are from the taxane group, such as paclitaxel and docetaxel, which can slow down the cellular activity required for the cell division. Next, platinum groups such as cisplatin and carboplatin are also used during chemotherapy, and it also widely used now because it is very few side effects without affecting the treatment effect. Chemotherapy can be given as a single agent or as a multi-agent, or also known as mixture. Apart from undergoing tests, treatment, and taking medicine from the hospital, patients should also lead a healthy lifestyle. A proper nutrition diet is very important to help replace damaged or injured tissue that occur during the treatment process. This is also important to ensure the improvement of the patient's body defense system. Patients are also advised to avoid processed food, carbonated drink, and food or drink in high sugar. Next, patients are also not encouraged to consume alcohol and smoking because it can cause a bad effect to the patient. Moral support from people around is very important for ovarian cancer patients. This is due to the fact that this disease not only affects the patient's physical health but also has the possibility of resulting in distress, depression, and anxiety.
Have you ever thought why our ancestors have a long chance suffering from a cancer? The first reason is a healthy diet. How different people in the past and now they intake per day. Organic food is grown without the use of synthetic chemicals such as human pesticide and fertilizer. All of this does not contain GMO. Organic food includes fresh food, meat, dairy products, as well as processed foods such as crackers, drink, and frozen meal. For the GMO, a genetically modified organism is an animal plant microbe whose DNA has been altered using genetic engineering technique. For thousands of years, humans have been breeding methods to modify organisms. Corn, cattle, even dogs have been selective bred over generations to certain desired traits. Early detection is a good management for high risk of ovarian cancer, especially family history, intolerant hormone body, and having late pregnancy or never having a full-term pregnancy. The first one is screening test help find cancer at early stage before a person shows any symptom. Type of screening tests including physical exam, history, laboratory tests, imaging procedure, and genetic tests. The second one is pap smear or pap test, a procedure in which a small brush is used to gently remove cells from the surface of the cervix. Then the cell will be checked under a microscope to see if any changes lead to a cancer. A pap smear may also help detect infection or inflammation. The procedure is also done at the same time as a pelvic exam.
Thank you, Najwa, for your explanation. So now let's go to the final part, which is the consequence of those management method. Okay, when it comes to cancer and eating healthy, I want to highlight a few things. First, we need to ensure that we consume the food that have high level of antioxidant. Why? Because antioxidant can protect our cell from getting damaged. So in this case, we know that cancer happen when there are cells in our body that get damaged or mutated in terms of DNA. And antioxidant can help the spread or control the spread of cancer in our body by protecting the cell around the cancer cell itself, so that the cancer cell need more time to damage cell around it. So the patient can get medical treatment early and have a longer time to treat the cancer. Second, we need to ensure that we cook our food properly, because there are chances that our food contain carcinogen. Carcinogen is basically a substance that can cause cancer in our body. So by cook our food properly, it can reduce the amount of carcinogen and eradicate carcinogen completely from our food. We don't want just only nutrient from our food, right? We also want our food to be safe. So the way we manage our food is really important, so that we consume the best foods as we can. Last but not least, we need to consume supplement. In the past, there has research that has been conducted that a woman that consumes oral contraceptive has lower risk to get ovarian cancer by 30% to 50% lower risk compared to women who doesn't consume oral contraceptive. So let's go for the screening test. Okay, screening test has existed since 1920s. If we want to say about screening test of ovarian cancer, screening test is really important and is a life savior for most cancer survivor, because when we detect the cancer early in an early stage, we can prepare a proper medical treatment and proper medical care for the patient. And for the patient, they can start to modify their lifestyle to be more productive, eat more healthy food, exercising, reduce their stress in their life, and start to do more positive things. When it comes to cancer, normally people say, "Oh, cancer is so depressing," because people that diagnosed by cancer will die because it has been diagnosed in late stage. It's too late to save the patient. So screening test in the early stage is really important. If you have something wrong with your body, just go to doctor and get medical checkup so that you know what's wrong. Okay, that's all from me. Thank you.